Welcome back to the Conquering Candida video series. Today we're going to be discussing in Chapter 4 the diagnostic staging and clinical symptoms of Candida. I like the opening quote that I have from, again, Dr. Louis Pasteur, the famous French chemist. In the fields of observation, chance favors the prepared mind. I remember my medical professors in medical school bringing this up in their lectures, and I think it brings a very important point that in medicine, if you don't have an open mind and look for the clues, you're not going to see it. Now, the Candida staging I have in this chapter is my original staging that I based on 30 years of medical practice. It may not be perfect, and the sequence is not always the same in every patient, but it is an extremely helpful guide for any doctor or patient that wants to know at what level is their Candida. Stage 1 is the gastrointestinal phase. This is where I have patients that have symptoms of bloating, constipation, diarrhea. These are all very similar symptoms to what's been called irritable bowel syndrome. Dr. Mark Pimentel, as I've mentioned before, actually discovered that many cases of irritable bowel syndrome are due to SIBO, small intestinal bacterial overgrowth, and he has devised a therapy for that. Dr. Satish Rao, also someone that I interviewed on my podcast, The Smartest Doctor in the Room, has been one of the leading proponents of something called SIFO, small intestinal fungal overgrowth, which really directly relates to the work that I do with Candida overgrowth in the gut. So many of these cases of IBS are either due to SIBO, bacterial overgrowth, or SIFO, fungal or Candida overgrowth. And the third doctor I really want to mention who's done some fascinating work is Dr. Alessio Fasano. He's a well-noted celiac expert at Harvard Medical School. And Dr. Fasano, what he did, which was so important, was to show that gluten that affects the intestinal lining and causes inflammation doesn't just stay in the gut, but it actually goes through something called leaky gut, and that's why celiac patients have a multitude of symptoms that can go beyond the gut. And this really relates to what I see in Candida as well. The second stage of Candida is really where the leaky gut comes into play. If a patient's had an overload of Candida in their intestinal symptoms, it can get out through the leaky gut, through the cell lining, and go to different places. I believe that's why so many of the women who suffer with chronic vaginitis and don't get better, because the doctors are just treating the vaginal area and not treating the origin in the gut where the Candida is coming from. The same thing in chronic dermatitis. I see a lot of dermatologists are using creams for different fungal rashes when in reality these patients need to have their gut microbiome rebalanced. And then unfortunately in chronic sinusitis, I have a lot of my ear, nose, and throat colleagues that they're a little bit frustrated. They see these patients that have chronic symptoms and they typically treat them with recurrent courses of antibiotics and oral steroids. And while the patients sometimes initially feel a little bit better, overall it's like taking a few steps backward because their Candida overgrows, continuing the inflammation. Stage 3 in my staging protocol, I see patients that present with brain fog, anxiety, poor concentration. I mentioned about in the book why this occurs, as the Candida, as it continues to essentially brew in the intestine, produces acetaldehyde and even alcohol. So a patient is literally mildly drunk. Stage 4 involves chronic fatigue and fibromyalgia. And in my practice over the years, I have seen many patients present with severe chronic fatigue. And typically these patients, which is frustrating to their doctors, have normal labs, so nobody knows what's going on. But when I'm able to diagnose Candida and treat them, I can see dramatic improvements. In the next upcoming video of Chapter 5, I'll be discussing the unique protocol that I've designed in treating Candida patients. So if you've liked this video, please go to our YouTube channel, The Smartest Doctor in the Room, hit subscribe. We really appreciate it.